On today's episode, we'll be answering an often asked listener question. Can sleep apnea go away on its own? I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I hope your weekend is going well and you have lots of fun stuff planned for this week. I wanted to take an opportunity to answer a question that I've received a couple of times from different listeners, most recently from Charles in Arizona. And the question is, can sleep apnea go away on its own? So in order to answer this thoroughly, I think we need to sort of look at what is happening with sleep apnea in and of itself. So, for example, with sleep apnea, especially in the United States, up to 21% of women and up to 31% of men report having obstructive sleep apnea. Now, we're going to talk specifically about obstructive sleep apnea. There are other types of sleep apnea, but obstructive is the crux of this question. So, what is happening with the upper airway with obstructive sleep apnea? We have mentioned in the past, there are some other episodes that go a little bit more in depth, but in essence, the muscle tone in the upper airway relaxes when we go to sleep and the airway closes off. That's the obstruction. Sometimes it is a complete obstruction, which is the apnea. Sometimes it is a partial obstruction, which is called hypopnea. Either way, it can have the same effect on our nighttime sleep. Disrupts our sleep, leads to all sorts of fun and interesting problems down the road. So what we need to do to answer the question is to look at what's happening with the structure of the upper airway. So for example, I mentioned that the airway closes off. Are there things that are contributing to the airway being smaller than it would normally be? For example, do you still have your tonsils? We talked about last week, thyroid issues. The thyroid gland is located in the throat and it can swell and cause the upper airway to be a little bit smaller than normal. Do you have excessive weight? Because excessive adipose tissue distributed throughout the upper airway can lead to that airway being a little bit smaller. Naturally, as a process of aging, the loss of muscle tone is also going to have an impact on whether or not sleep apnea is present. So as we get older, we lose muscle tone, the airway is more likely to close off. So given all of these things that can contribute to the process of sleep apnea, the answer to the question is that no, the process itself will not correct itself, and it will require some type of intervention. Now, there are a lot of different ways that sleep apnea can be affected as far as causing it to be having less of an impact on us. Some very simple things that we can do ourselves would be weight loss. We've seen numerous patients come through sleep disorder centers across the United States that have had excess weight and have lost a significant amount of weight, 50 to 75 pounds. And they've been able to come off of their therapy, their CPAP therapy, for example, if that's what they were placed on, because they have brought their sleep apnea index down to the point that it's within normal ranges. And that's mainly just in cases where the upper airway was so occluded by the excess weight that it was more likely to close off. In fact, we had one patient recently through my sleep disorder center. That was the exact case. The patient went from having moderate sleep apnea to having no sleep apnea. Brought his sleep apnea index down to within normal ranges just by losing some weight. Now, I say typically 50 to 75 pounds. It usually takes that much for things to be affected, but you may be within a very small, very delicate range. So it may not take that much weight. It may take 10, 20 pounds for you, especially if your sleep apnea is relatively mild. Now, there are also some behavioral things that we can do to affect whether or not sleep apnea is present. Let me ask you, do you smoke? Did you know that smoking introduces, and this, I'm not being facetious, but smoking does introduce irritant chemicals into the upper airway, and those chemicals can cause that tissue to swell. And if that tissue is swelling, that means that the upper airway is smaller than it normally would be. So there's more of a likelihood for sleep apnea to be present. Also, are you somebody that has a drink at night before you go to bed? Alcohol is a depressant, so it will actually cause the muscle tone to relax even more so. You may have noticed this yourself, especially in your younger days when you would go out having a drink or two with friends. You may snore the night that you come home from a party or from a bar, and not normally snore at other times. And that's the effect of the alcohol. Also, sedatives, things like central nervous system depressants, sleeping pills, can cause the muscle tone to relax enough so that it actually does close off a bit during sleep. So those are some behavioral things: avoiding alcohol, maybe avoiding some of those central nervous system depressants. Look at other ways that you can get a good night's sleep without having the need to take medication. There are also medical devices that can help you sleep without the effect of sleep apnea, specifically a CPAP, continuous positive airway pressure device. It's a small mask that patients wear on their face that uses room air to help keep the upper airway open. Another even more extreme step would be a surgical alternative to improve the sleep apnea. And there are several different ways this can be done. The upper airway itself some of the excess tissue can be removed to make the airway a little more open. There are also various types of implants that can either pull the muscle tone or pull the muscles forward in the back of the airway to help keep them from closing off when they relax. Also, there are devices that use an electric pulse to stimulate the muscle tone in the upper airway each time you breathe. It's a device called Inspire, and it actually senses whether you start to take a breath, and it increases the muscle tone when you do that to keep the apnea from occurring. So Charles in Arizona, you have some thinking to do. If you're beginning to notice the effects of sleep apnea, you have some choices. You will need to do a little bit of work, either on your own or with the help of your medical professional, your primary care provider, or a trip to the Sleep Disorder Center locally, just to look at some of your options. But there is always hope. Sleep apnea is a very treatable disorder, and it's something that once it's treated and it's not affecting you, you will notice a big difference in the way you can live your life. I hope this has been informative for you. If you have any other questions, please keep sending them to me. j@somnilopod.com is email. You can also contact me through Facebook and Instagram and Twitter. You can also send messages to the YouTube channel as well. So until next time, please remember to make sleep a priority. Thanks so much. Bye-bye.